Oh, is coffee healthy? I'm Dr. John McDougall. I want to tell you, is coffee healthy? Oh, it's been one of my favorite drugs. That's a disclaimer I have to make, and to tell you what my biases are. Coffee's fun. A cup of coffee when you get up in the morning, it wakes you up. It gets you stimulated in your thinking. Of course, it keeps you awake at the end of the day too. So all that stimulation may not be so good. Yeah, a little bit of coffee results in maybe the kind of pleasure you like. But you know what happens to me, and I'm sure many of you, if a little bit felt good, I bet a lot will feel better. And it doesn't. Start overdosing on coffee, you get tremors. It really becomes aggravating, irritating, excitable. It's a drug. It's a stimulant. The other things that coffee does throughout the body, it makes an impression. See, does it do anything good? Well, I suppose you can make the argument it does make you think clearer and cleaner in the morning or throughout the day, picks you up. As far as any benefits, does it reduce the risk of cancer and heart disease? There actually are articles that show drinking coffee reduces the risk of heart disease and cancer. As an addict, I look forward to those articles, and I love to hear good news about their bad habits, but probably not true. It got published because people love to hear good news about their bad habits. How about the negative things about coffee? Well, coffee stimulates the production of acid in your stomach, and any serious coffee drinker carries around a packet of Rolaids or Tums in their pocket because they're constantly fighting indigestion. And one of the things that's really important for you to note is that decaf coffee causes as much acid secretion and stimulation and indigestion as regular coffee, because it's not the caffeine, it's the other alkaloids in the coffee bean that cause the irritation of the stomach and the production of acid. So if you're going to try and fix stomach trouble, you don't want to switch just to decaf. You're going to have just as much trouble. Other things that coffee causes is it raises cholesterol. And it may follow that it increases your risk of artery disease. I'm not trying to say that, but it may. It raises your cholesterol level. Now, there were some experiments done back in the 1980s and published in good journals on whether or not drinking coffee raised cholesterol. And again, these were sincere, good researchers. And on one hand, it showed that drinking coffee raised cholesterol. And other groups of researchers found that it didn't raise cholesterol at all. And it wasn't until fellow researchers looked at the different methods of brewing that they figured it out. When you cook coffee in a percolated type of mechanism, where you put the ground coffee in a strainer or container and just boil water through it, and that's the way you get your coffee. Then what happens is substances that are in the coffee bean that raise cholesterol, they end up in your coffee cup. If you make your coffee by using a paper filter, what happens is the paper filter actually takes the cholesterol raising substances that were present in the coffee bean out, and so it doesn't raise cholesterol. I have to tell you that decaf coffee raises cholesterol even more than regular coffee. Maybe because it's rarely brewed through a paper filter, or maybe it's something about the kind of bean that they use in decaf coffee, but both of them are going to raise your cholesterol. Coffee is very irritating to our excreting organisms. For example, any serious coffee drinker knows about frequent urination. And most serious coffee drinkers know about frequent bowel movements. In other words, you know where every bathroom is in every building in town if you're a serious coffee drinker. So, that may be a reason to drink or not drink coffee. I mean, some people drink coffee to kind of get that early morning urge to get themselves some relief. But if you find yourself getting up all night or, excusing yourself during office meetings because you have to urinate, it's the coffee. You want to get that out of your diet. So I think those are some of the major issues. It can, it's called a bad habit for a reason, but it's also a very, it's a fun drug. And you got to decide whether it's taking more out of your life than adding to your life. Certainly, there have been many, many times in my life when the negative effects, the adverse effects, the indigestion, and et cetera, got to the point where I said, I have had enough. And you know what? The body cures itself quickly. I mean, within 2 or 3 days, you'll be better. Not sleeping at night, stop the coffee. 2 or 3 days, you'll be sleeping better. You want to have the best cholesterol level that you could possibly get? Well, in addition to getting all the animal foods out of your diet, eating a starch-based diet, quit the coffee, or at least brew it through a paper filter. So I'm Dr. John McDougall.